Good morning. We are going to start. Today we are going to proceed with the second part of the lecture we had started, which is on the physiology of the autonomic nervous system. In the first part, we covered more about the general organization of the autonomic nervous system. In this second part, we're going to cover on the organ system effects. Well, we'll cover more than that. We'll also cover the autonomic, what is it called? The enteric nervous system. And then we'll also look at the differences between autonomic nervous system and the somatic nervous system. Now, maybe a few things that you still need to remember, although we said them last time. I'll just do an overview of what we did last time. Then we focus on today's agenda. So last time we said that the nervous system is functionally divided into an afferent and efferent division. The afferent division, being the sensory division, consists of either spatial sensations and general sensations. When we talk of spatial sensations, we mean things like vision, smell, taste, hearing, and equilibrium of the head. When you talk of general sensation, we mean things like pain, temperature sensation, which can either be heat or cold. We talk about touch sensation, talk about pressure, talk about vibration and equilibrium. Those are sensations. Well, in other scenario, you can still classify the afferent division as either somatic sensations and visceral sensations, depending on where the sensations come from. The efferent division of the nervous system is divided into somatic nervous system and the autonomic nervous system. When you talk of somatic nervous system, we're referring to innervation to skeletal musculature. When you talk of autonomic nervous system, we talk about the nerve system that targets the smooth muscles, cardiac muscles, and glands. The glands in reference here are the exocrine glands. So we say that the autonomic nervous system is a division of the nervous system that is concerned with subconscious functions. These are functions which are involuntary. You do not have control over them. The target of the autonomic nervous system, as we've said, are cardiac muscles, smooth muscles, and exocrine glands. Generally, the autonomic nervous system is responsible for maintaining homeostasis of body functions. You can actually survive without the autonomic nervous system. However, you'll find it difficult to adapt to environmental stimuli or environmental stresses, because the autonomic nervous system helps us to adapt to environmental stresses. We say that autonomic nervous system consists of sympathetic and parasympathetic divisions of the nervous system, and that these two systems supply various organs of the body as long as they have those target tissues that you talked about. Now, in terms of the innervation, this one you may come to notice as we go along, that there are some organs which are innervated by both systems, both sympathetic and parasympathetic system supply those organs. There are some organs which are only controlled by one of the system, and especially the sympathetic system. In as much as we're talking about autonomic nervous system having two divisions, there's a third division of the autonomic nervous system, which are called the enteric nervous system, which controls GIT functions. And towards the tail end of this lecture, we're going to talk about the enteric nervous system. We mentioned a number of differences between sympathetic and parasympathetic division. And from an anatomical point of view, which is projected in the images here, to your left is sympathetic system and to your right is parasympathetic system. One of the big differences between sympathetic and parasympathetic system is the origin of the preganglionic neurons. In sympathetic system, this is a thoracolumbar outflow. In parasympathetic system, it's either cranial or a sacral outflow. The other difference was based on the length of the preganglionic neurons, where in sympathetic system, the preganglionic neurons are short, the postganglionic neurons are long. In parasympathetic, the preganglionic neurons are long, the postganglionic neurons are short. Well, there were other differences that you must have also talked about, and we looked at them at length last time. At least remember that sympathetic is thoracolumbar and parasympathetic is craniosacral. In terms of their origin from the spinal cord, we didn't mention this last time and I want to repeat it. I want to mention it now. In terms of the origin of the autonomic fibers from the spinal cord, you know, this is the anatomy of the spinal cord in cross section. We have white matter outside and gray matter inside. This thing which looks like H is the gray matter of the spinal cord. The gray matter of the spinal cord has three horns: the dorsal horn, lateral horn, and the ventral horn. The lateral horn is not present in all the parts of the spinal cord. It is only present where the spinal cord gives rise to the autonomic efferents. And so the lateral horn is the one that contains cell bodies of the preganglionic neurons, as opposed to the ventral horn, which contains the cell bodies of the somatic neurons. The dorsal horn receives sensory inputs. So dorsal horn is sensory, ventral and lateral horn are motor. So dorsal horn is sensory, ventral and lateral horn are efferents, yes, but lateral horn is for visceral efferents. Ventral horn is for somatic efferents. In terms of functions, we talked about sympathetic nervous system being the system that excites your body under emergency situations. Because sympathetic nervous system utilizes energy, we describe it as being catabolic. The responses that are provided by the sympathetic nervous system can be described as fight or flight responses. And the model I asked you to use is assume wherever you are right now, a cobra just pop up. How do you respond? The type of responses that you're going to get are those fight or flight responses, which are largely by sympathetic nervous system. The effects of the sympathetic nervous system are mediated by adrenaline, which is secreted from the adrenal gland following sympathetic stimulation, as well as noradrenaline, which is secreted from the nerve terminals, the postganglionic sympathetic nerve terminals. So these are the key neurotransmitters in the sympathetic nervous system. Of course, we talked about a few exceptions last time. Now, these two chemicals act by stimulating their receptors, and their receptors, we call them the adrenoceptors. Okay, for parasympathetic nervous system, we mentioned that it is concerned with vegetative aspects, vegetative functions. So generally, the parasympathetic nervous system conserves body energy and therefore is described as being anabolic. The effects of the parasympathetic system are therefore commonly described as being rest and digest responses. And if you want to evaluate how parasympathetic works, then assume that you've just overeaten some githeri and you're just at home relaxing, watching the TV or whatever. How does your body respond in those situations? The physiological effects of the parasympathetic system are caused by cholinergic stimulation. The physiological effects of the sympathetic system are caused by cholinergic stimulation. The term cholinergic means that the neurons are releasing acetylcholine as their neurotransmitter. Now, the receptors of acetylcholine are cholineceptors. We also elaborated on those types of receptors for cholineceptors as well as for adrenoceptors, and I told you that the key adrenoceptors, we have beta adrenoceptors and alpha adrenoceptors. And for beta, we talked of beta 1 and beta 2. Beta 1 being in the heart, beta 2 in the respiratory system. We talked about alpha 1 and alpha 2. Gave you different places where those two are found. For cholineceptors, we talked of neuronal nicotinic receptors, which are found in ganglia. We also talked about muscle-type nicotinic receptors, which are found in neuromuscular junctions. So that one is not concerned with autonomic system, but we also talked about muscarinic receptors. The muscarinic receptors are the ones which are of utmost interest when you're talking about the autonomic nervous system. They are present on cardiac muscle, smooth muscle, and glands. So therefore, today we want to look at the organ system effects of sympathetic and parasympathetic system. We are going to pick a few organs and we're just trying to look at what happens when you stimulate this system. And just assume in this column of sympathetic that we are talking about adrenoceptor stimulation, unless specified otherwise. And for parasympathetic, we are talking about cholinergic stimulation. So this is adrenergic stimulation, and this is cholinergic stimulation, unless otherwise specified. Also, take an assumption that in sympathetic stimulation, which is adrenergic stimulation, a cobra has just appeared in front of you. So how will these organs behave? And here, assume we've just overeaten. How will that appear? Let's pick a few organs. And I like starting with the eye. So you want to ask yourself, does the eye require autonomic nervous system innervation? And the answer is yes. Now, the role of the autonomic nervous system is not necessarily for you to turn your eye to the opposite direction or whatever. That one is not really an autonomic function. That one is mediated by skeletal muscles. So that one is somatic function. The role of the autonomic nervous system is on the iris. The iris has smooth muscles, and the iris controls the size of the pupil. No, that one you don't have control over. And so, under sympathetic stimulation, so which means if you see a cobra, how should your iris behave? Ideally, remember you want to either fight or run away. So you need enough amount of light to enter the eye so that you can either see that cobra or you run away from that cobra. Therefore, the iris will change in such a way that the pupil will dilate. And that is what sympathetic stimulation causes on the eye. It causes pupillary dilatation. In the opposite end, the parasympathetic stimulation will make your pupils to constrict. The pupillary constriction here is a function of the third cranial nerve. We gave it a name last time. We call it the oculomotor nerve. So oculomotor nerve is the one that stimulates the eye so that the pupil can constrict. Oculomotor is a cranial nerve. You'll be taught that when you want to know whether someone has died, one of the things you check is the pupil. Is the pupil constricted or is it dilated? When it's constricted, it somehow tells you that the brainstem is functioning. Oculomotor is intact. But when it is dilated, then it tells you that the brainstem is knocked off. And basically that's what death means. And so you'll be looking at people's pupils and determine whether they're dead or not. Well, it will not be the only thing you'll be checking, but one of the clinical things you'll be checking to ascertain clinical death. The other thing that also require autonomic innervation is the ciliary body. Now the ciliary body controls the shape of the lens. The lens can bulge or it can flatten. When the lens bulges, you see near. When the lens flattens, you see far. So if you encounter a cobra, you actually want to see far. And so sympathetic nervous system causes the lens to flatten. And this is an adaptation for far vision. But under parasympathetic stimulation, the lens usually bulges, you see near. And the term we give for bulging of the lens for near vision is accommodation. I want you to remember those two effects of the autonomic system on the eye. And you'll be using this knowledge a lot in your pharmacology, because now there are drugs which are supposed to help in widening the pupil or constricting the pupil. You'll be asked now in pharmacology, so what kind of drug should be used? What should they be doing to the sympathetic system or to the parasympathetic system? For example, if I want a drug that opens the pupil, then I'll give a drug that stimulates the sympathetic system, or at least stimulate the receptors of adrenaline and noradrenaline, the adrenoceptors. Let's look at the effects of these two systems on the cardiovascular system. And here I want us to look at a number of things. I want us to look at the effects of these systems on the heart rate. So remember here, the target is the cardiac muscle cells. So under adrenergic stimulation, the heart rate usually increases. Now this is following stimulation of the beta-1 receptors. Remember, beta-1 receptors are the ones on the heart. The term given for increasing heart rate is positive chronotropy. So we say that sympathetic stimulation has a positive chronotropic effect on the heart, to mean it increases heart rate. Now don't confuse positive chronotropy with tachycardia. The term tachycardia means a faster heart rate, a heart rate that's above 100. Positive chronotropy simply means increased heart rate. So increased heart rate could mean that the heart rate was now 60, now it has gone to 80. Or it was 100, now it's 120. That is positive chronotropy. Parasympathetic stimulation to the heart causes negative chronotropy. It means reduction in heart rate. Negative chronotropic effect on the heart is largely because of vagus nerve stimulation. That's the 10th cranial nerve. That's the one that goes to the heart for parasympathetic. Now, for you to control the heart rate, the specific region of the heart that need to be targeted is the sinoatrial node, because that's the pacemaker. So both sympathetic and parasympathetic systems have an effect on the pacemaker, and this is what they do. Apart from heart rate, the other thing we want to look at is the force of contraction of the muscles of the heart. Sympathetic stimulation increases the force of contraction. The term given to increased force of contraction is positive inotropy. So you'll be talking about inotropic drugs, drugs which increase the force of contraction of the myocardium, muscles of the heart. Parasympathetic stimulation, again, via vagus, has a negative inotropic effect, which means that the force of contraction is less. The third thing you look at in the heart is conduction velocity, the speed at which impulses travel along the conduction pathway of the heart from the sinoatrial node all the way to the muscles. Now you'll be taught about the conduction pathway of the heart, but there's what we call sinoatrial node, this is what we call the atrioventricular node, this is what we call the bundle of His, Purkinje fibers. So all those constitute what we call the conduction pathway. Now we want to see the speed at which impulses, the speed at which action potentials travel along the conduction pathway. Under sympathetic stimulation, that speed is increased, and the term given is positive dromotropy. So sympathetic will have a positive dromotropic effect on the heart, and parasympathetic will have a negative dromotropic effect on the heart. We also want to look at arterioles, the blood vessels specifically. So remember, the effects on the heart, on the myocardium, are largely following beta-1 stimulation. The arterioles might use another receptor, the alpha-1 receptors. Those are the ones which are predominant on the blood vessels. So stimulation of alpha-1 receptors causes vasoconstriction, and this applies for most of the blood vessels. There are a few blood vessels that may not have that alpha-1 as the dominant receptor, and so they may have different effects. But wherever alpha-1 receptor is the dominant receptor, the effect will be vasoconstriction, which means narrowing of the lumen of blood vessels. It might be tempting to say something on the parasympathetic part, but the point is that we do not really have parasympathetic nerve terminals to most of the blood vessels. Therefore, for most blood vessels, there'll be no effect. There'll be no effect for most of the blood vessels. But for a few that actually have parasympathetic innervation, there'll be effect. And towards the end of this lecture, you'll know which few ones actually have parasympathetic innervation. If you affect the heart rate, you also affect contractility, and you affect vasoconstriction in the manner we have described, then sympathetic system will cause an increase in blood pressure. This is because blood pressure is a function of resistance of vessels, which is based on this concept here, vasoconstriction, vasodilation. But it is also a function of the heart rate as well as contractility, because these two affect what we call cardiac output. So therefore, under sympathetic stimulation, the blood pressure is increased. Under parasympathetic stimulation, the blood pressure is increased, not because parasympathetic affects blood vessels, but because parasympathetic affects the heart rate as well as contractility. So those are the effects on the cardiovascular system, or we can say some of the effects on the cardiovascular system. Let's take another system, the respiratory system. On the respiratory system, I want to look at two things. I want to look at the diameter of the airways. So under sympathetic stimulation, which means adrenergic stimulation, the airways usually increase in their diameter. Excuse me. The airways increase in their diameter, and that's what we call bronchodilation. Under parasympathetic stimulation, there is bronchoconstriction. So here, the smooth muscles of the airways, either the bronchi, bronchioles, are the ones which contract and cause bronchoconstriction. Here, the muscles relax, so causing bronchodilation. You'll remember that the receptor here for the sympathetic system, the receptor here is beta-2 adrenoceptors. For this column, nothing much because they're all muscarinic basically. But here, you need to remember them. So this is beta-2. The other effect on the respiratory system is concerning secretions along the airways. So under adrenergic stimulation, we have reduced secretions. But under parasympathetic stimulation, we have increased secretions. You'll be told that when a patient needs to go to theater, there's some drugs that need to be given. That drug primarily reduces the secretions in the airways so that the patient does not aspirate when they are under general anesthesia. Those drugs basically inhibit the parasympathetic system. The other system I want us to look at is the digestive system. So one of the effects of the autonomic nervous system is on the salivary glands. Now, if you realize, most of the things we've talked about so far are where we have both systems innervating, and that both systems, the systems are causing somehow what we can call antagonistic effects. In the heart, one increases heart rate, the other one decreases heart rate. And that's what we call antagonistic effect. So dual innervation with antagonistic effects. Dual innervation to mean that the organs are supplied by both sympathetic and parasympathetic system. So they are dual innervation with antagonistic effects. But there was one scenario we talked about in blood vessels where it was not dual innervation. It was just single innervation. I alluded to that earlier. In the salivary glands, it's very interesting. It is dual innervation, but there are different effects. Now, why do we say so? Because sympathetic stimulation causes you to produce a lot of thick saliva, but parasympathetic stimulation causes you to produce a lot of watery saliva. We don't want to call these ones antagonistic effects. We call them different effects. How about peristalsis? Peristalsis is the contractions within the smooth muscles of the JT. Okay, it could be smooth muscles in any luminal organ, but here we're talking about the alimentary canal. So those contractions, the intestines, the ones that promote movement of food from your mouth to the other opening without you knowing. So under sympathetic stimulation, there is reduced peristaltic activity. Now, how to think through this is not really, you have to understand it from logic. If you see a cobra, how would contractions of your intestines really help you fight or flee? It won't help you. So there'll be reduced peristaltic activity. But if you've overeaten, there's every reason for peristalsis to actually increase. I'm saying that because sometimes you may have this scenario where someone is too scared until they get diarrhea. And then you're saying now that's sympathetic effect. No, that's not sympathetic effect, just that you're too scared, you've just confused your system. But the actual sympathetic effect is reduced peristaltic activity. So I want to ask about the sphincters then. Think through the sphincters. If you see a cobra, should the sphincters open or should the sphincters tighten? Okay, I'm giving you 10 seconds to make a decision, then I go on. So the sphincters, usually, the tone of the sphincters will increase under sympathetic stimulation. The reason the tone increases is so that the sphincters can become tight. Because when you see a cobra, that's not the time to go to the loo, really. So the pyloric sphincter will tighten. The anal sphincter tighten. The idea here is to reduce outputs. Okay. Parasympathetic stimulation will reduce the sphincter tone. So the sphincters relax. Things can move. Acid secretion from the stomach is reduced by the sympathetic stimulation and increased by the parasympathetic stimulation. You'll be told that actually parasympathetic stimulation can sometimes be manipulated to manage people with excess acidity by just cutting off the nerve supply to the stomach, which is still vagus nerve actually. The effects that we're talking about here are largely vagus nerve, apart from the first one there for salivation. which could be a different nerves. We talked about them last time. The nerves which are parasympathetic to salivary glands are the 7th nerve, which is facial nerve, and the 9th nerve, which is glossopharyngeal nerve. But all the other effects are through vagus nerve. If you if you reduce peristalsis, there'll be no movement of food or reduced movement of food. And you tighten the sphincters. It means that really nothing is passing down. So the type of stool you're going to get under sympathetic stimulation is very hard stool, as opposed to in the parasympathetic stimulation where you've increased peristalsis and you've even relaxed the sphincters. This person can actually have diarrhea. So this person can actually have diarrhea. Okay. I want to ask you a question. I'm going to ask you 2 questions. The first question is projected on your screen, but let me give it to you as a poll. So the poll is on your screen. You can answer it. Your time is up, so I'll close it now. I'm sharing with you your responses. Now, you've not answered it well. You see, asthmatic attack usually is associated with bronchoconstriction. There is narrowing of the airway, and there is also increased secretions. But let's focus on the narrowing of the airway. If the airway narrows, you want to manage that. Then you want to give something that opens, that dilates the airways. You need to give something that will cause bronchodilation and also cause something that will reduce the secretions on the airways. So in as much as the beta adrenoceptor agonist stimulates the sympathetic receptors, you'll not give these ones because beta 1 is not in the airway. Beta 1 is in the heart. You don't use beta 1 agonists if you're targeting the respiratory system. Now, parasympathomimetics mean that these drugs mimic the effects of the parasympathetic nervous system. Again, if you give a drug that mimics the effects of the parasympathetic nervous system, you're going to worsen the asthmatic attack because you're still going to cause more bronchoconstriction. Parasympatholytics will be the correct response. Drugs which inhibit the parasympathetic nervous system. Those ones can be used in the management of asthma, and they're actually used in the management of asthma. You'll be told a number of them. Muscarinic receptor agonist is also not a good offer because these are still parasympathomimetics. I'll give you another question. That's a question. I want you to answer it in the poll as well. It's projected for you. You have 1 minute. So your 1 minute is over. So this is well answered. I'm sharing with you your results. I'm a bit concerned though. There are people who have never gotten anything correct on these questions I give you. Hata moja. But okay, let's go on. The other system I want to look at is the renal system. In the renal system, we are going to look at the effects of these two systems on renin secretion. Renin is an enzyme that is secreted by the kidney to convert what we call angiotensinogen to angiotensin 1. That is a hormone. This hormone is important in regulating blood pressure. So under sympathetic stimulation, there is increased renin secretion from the kidney. And under parasympathetic, there is reduced renin secretion from the kidney. Also still on the urinary system, for the urinary bladder, under sympathetic stimulation, the contraction of the bladder reduces, and parasympathetic increases contraction of the urinary bladder. How about the sphincters of the bladder? Think through, if you see a cobra, what will help you? Is it when you pee or when you don't pee? So ideally, really, in as much as you might pee when you see a cobra, that won't really help you fight or flee. So sympathetic system causes increased tone of the bladder sphincter so that you hold urine. And parasympathetic is what makes the sphincter of the bladder to relax. Therefore, if you look at urine output, in sympathetic stimulation, you hold urine. It explains to you why you can hold urine while running around the field for long. But under parasympathetic stimulation, there is increased urine output. The other system is the genital system. The blood vessels in the erectile tissues are the ones which are of concern. The blood vessels of the erectile tissues vasoconstrict under sympathetic stimulation. Now, we had talked about vasoconstriction for blood vessels under sympathetic stimulation. That's not a big deal. Now, the big deal is here that under parasympathetic stimulation, the blood vessels of the erectile tissues vasodilate. Now, erectile tissues are the tissues, the blood vasculature within the penis and the clitoris. Now, those ones, parasympathetic system innervates them. Maybe the effect may not be cholinergic. Maybe the neurotransmitter may not necessarily be cholinergic, but it's still a parasympathetic effect. If the blood vessels of the erectile tissues vasodilate, then you'll realize that parasympathetic stimulation is what will cause erection. So penile erection is due to parasympathetic stimulation. And it makes sense, you know, really, if you see a cobra, that's not the time for the penis to erect. But if you've overeaten, it's okay, it can happen. However, even though parasympathetic causes erection, sympathetic nervous system is the one that causes ejaculation. Now, this is also interesting. Two systems acting on the same organ, so dual innervation. But how do you describe these effects? These effects are synergistic. One causes erection, then followed by ejaculation. They have synergistic effects. Now, that's the third type of effect that we've described. Remember, the first type of effect we described was dual innervation with antagonistic effects. The second type of effect we described is single innervation. Now here, we are talking about dual innervation with synergistic effects. Okay, we had also talked about dual innervation with different effects. So we've described 4 types of effects so far. Actually, those are the 4 types of effects that are usually described in sympathetic and parasympathetic nervous system. Okay, on a uterus that is gravid, there is also an effect, and this is largely beta 2. Beta 2 stimulation causes relaxation of the uterus if the uterus has a baby. We do not really have parasympathetic effect on the myometrium. So, single innervation. Okay, sweat glands. Sympathetic nervous system causes increased sweating. The increased sweating here is not an adrenergic effect, but a cholinergic effect. You remember sweat glands was one of the exceptions that we talked about. It's a cholinergic effect, but it causes increased sweating. There is no parasympathetic innervation to sweat glands. In the liver, sympathetic nervous system causes breakdown of glycogen to release glucose because you need it for energy. It is catabolic. Sympathetic is catabolic. Again, no parasympathetic effects on glycogenolysis. On adipose tissue, sympathetic nervous system also stimulates the fat cells to release fatty acids, which is required for energy. No parasympathetic effect on adipose tissue. Lastly, on the adrenal gland, we mentioned this last time. Sympathetic stimulation causes the adrenal gland to release adrenaline. Now, this is also cholinergic, but this cholinergic is the preganglionic, not postganglionic, the preganglionic stimulation to the adrenal gland. So that adrenal gland is actually acting as a postganglionic neuron in quotes. There's no parasympathetic innervation to the adrenal gland. So these are the organ system effects that I wanted to take you through. Remember them. This lecture is very important because you'll still use this information a lot in your pharmacology. I'll give you a 5-minute break. When you come back, we talk about the enteric nervous system. If you have a question, you can post it in the chat. When you come back, I'll start with those ones. So it's now 9:35, so we come back at 9:40. Okay, I can give you 10 minutes, so let's come back at 9:45. 10 minutes break. Now, we're going to look at the enteric nervous system. The enteric nervous system is an intrinsic nerve plexus within the wall of the alimentary canal. It's a nerve plexus within the wall of the alimentary canal. There are two types of plexuses within the wall of the alimentary canal. There's one within the muscular layer. We call that the myenteric plexus. The myenteric plexus is within the muscular layer. The nerve plexus within the muscular layer regulate peristalsis, the contractions along the GIT. The second type of plexus is the submucosal plexus. Submucosal plexus is within the submucosa, within the submucosa of the GIT. The submucosal plexus regulate secretions along the GIT. They could be endocrine secretions or exocrine secretions. Even though you have those plexuses have extensive connections with each other, but they also have connections with the sympathetic and parasympathetic nervous system. So sympathetic nerve terminals end on them. Parasympathetic nerve terminals also end on them. It is said that the enteric nervous system is functionally independent, which means it can function on its own even without the rest of the nervous system. However, the rest of the nervous system offer the regulatory role. And that's where now the sympathetic and the parasympathetic comes in to offer that overarching regulatory role of increasing the speed of things or reducing the speed of things. There are a number of neurotransmitters which are used in the enteric nervous system beyond the regular acetylcholine and norepinephrine. We will revisit this story when you look at the physiology of the digestive system. That will be next semester. Okay, I think I've already taken your attendance through the polls that you've responded to, so I'll skip that one. Let's finish by looking at differences between somatic and the autonomic nervous system. There are a number of differences between the somatic nervous system and the autonomic nervous system. One of the differences you can compare is based on the number of processes which come from the central nervous system. For somatic division of the nervous system, you only have a single process that comes from wherever the spinal cord or brainstem to the target organ. But for autonomic system, we say there are two processes. And we call this the preganglionic neuron and the postganglionic neuron. The other difference is based on the horn of origin from the spinal cord. Where do the nerves come from the spinal cord? For somatic division, the nerves come from the ventral horn of the spinal cord. For autonomic division, they come from the lateral horn of the spinal cord. The other difference is based on the segments of origin. Which spinal cord segments give you these nerves? For somatic nervous system, they come from all segments of the spinal cord. All segments of the spinal cord give you somatic nerves. However, for autonomic system, they either come from T1 to L3 for the sympathetic outflow, that's what we call thoracolumbar, or they come from S2 to S4 for parasympathetic. Remember, we are focusing on the spinal cord here. That means you don't expect all the segments of the spinal cord to have the lateral horn. Only the segments which give you autonomic outflow will have the lateral horn. The type of neuron that is utilized for these divisions are also different. For somatic division, all the neurons are myelinated. For autonomic division, the postganglionic neurons are not myelinated. The preganglionic neurons are myelinated, the postganglionic neurons are not myelinated. The effector organs are different. Somatic nervous system targets skeletal muscles, while autonomic nervous system targets cardiac muscle, smooth muscles, and glands. The type of control by the CNS is also different. We agree that somatic division is under voluntary control, while autonomic division is subconscious. We can also compare the presence of ganglia. The somatic nervous system being just a single process, we don't have a ganglion. But autonomic nervous system has a ganglion because we have pre and postganglionic neurons. The type of neurotransmitters also differ. For somatic nervous system, all the neurons are cholinergic. These are the ones that stimulate skeletal muscles at the neuromuscular junction. They are cholinergic. But for autonomic nervous system, they could be cholinergic, yes, but they could also be adrenergic, and there are even other options as well. You can compare the types of the cholinergic receptors for where they are cholinergic. For somatic nervous system, there are muscle type nicotinic receptors, while for autonomic system, we talk about muscarinic receptors for the target organs, and we talk about neuronal nicotinic receptors on the autonomic ganglia. Lastly, we can compare the presence of an endocrine component. And somatic division doesn't have an endocrine component, while the autonomic division, at least the sympathetic division, has an endocrine component. So these are the differences between somatic nervous system and autonomic nervous system. So we'll stop there. That is what I had for you. I'll invite you for questions.